Welcome to the SPRT Therapy Podcast, where top doctors, trainers, and athletes share their secrets to moving better, recovering better, and performing better.
I'm going to tell you right now, if it wasn't for Tim Brown, I would have never walked again or surfed.
Please join hosts Dr. Tim Brown and Dr. John Pecora for today's conversation.
All right, here we go. Thank you so much for joining us for the SPRT Therapy Podcast.
I'm Dr. Tim Brown.
I'm Dr. Drew Morcos.
And I'm Dr. John Pecora. Thank you so much for joining us. Drew, thanks for jumping on. We've known you for years. It's been a long time. We've collaborated a lot over the years. I think that I'm trying to think if Gabriel Hernandez originally introduced us.
Yeah.
Years ago. You were working with some pretty high level boxers, traveling a bit. We're all in Orange County. And obviously the relationship has evolved over the years, and, we spend a lot of time collaborating with athletes and learning from you, and, being blessed with your background and your experience. You're going to be speaking at the SPRT Therapy Sports Movement Symposium in a few weeks. You're a sports PT legend. You're a DNS instructor. You're a USC professor. We call you the real Dr. Drew. I think years ago, when I was working with Meyer, we were in New Orleans together at the Sports PT conference, or maybe it was CSM.
Mm-hmm.
And you were one of the highlighted speakers. So maybe, and I think we want to kind of update TB around the world. We'll talk a little bit about Tim just getting back from Canada, and then kind of go into your background a little bit. But we always like to update everyone as to where Tim's been, TB around the world. And Tim, you just got back from Canada working with Neil Young for a week. How was that?
Oh, what an experience, man. What a guy, I mean, I've had the honor and privilege to know him for a while now. And he's almost 80 and he's going on this mad tour, of course, just after we talked about chilling out now and, taking his time, doing a few gigs here and there. And now he's just, he's got the band back together. And he's going to go rock Europe. So,
That's awesome.
Yeah, it's great. And Canada's so beautiful, man. I've never been to that part of Canada. I've been to BC and Vancouver, but I've never been to, Toronto, Ontario zone and where he grew up, a place called Omimi in Canada, just a really small, humble town where his dad was a famous sports writer, and he had a whole school named after him. And so his family's name is rich in that area, and of course they were out of their minds stoked to receive him and have him come do a nice little benefit concert for a school called The Farm out there, where it's kind of miles ahead of how we're educating our children and in kind of in the environment of nature. So it was a great trip all around, and he's just such a great humanitarian and a great person that's out there for peace and saving the world, and not just a guy that talks it but actually lives it. I mean, composting and everything around their house, it's a serious thing. And so I got lessons, I got experiences, I got stories, and nothing could be better than spending a little time with old Neil Young.
That's great. That's God's country up there.
Yeah,
it's
truly
it's amazing. Yeah. So we've got limited time today, just because I think we all have to get back into the clinic on a busy Friday morning. But thanks again, Drew, for joining us.
Appreciate you guys having me. It's been something I've been wanting to do for a long time.
Thank you.
Yeah. We appreciate you, and maybe you could just give everyone a little bit of background. You're once again a high level sports physical therapist. Maybe talk a little bit about what got you into sports physical therapy, a little bit of background of you as a younger athlete, which I'm sure helped to kind of lead you, down this path. And then we'll get into a little bit of how you utilize DNS and some of the concepts that you guys use. I mean, Modus, how many locations do you have now? You're building an empire right now.
Yeah, we have four in the Orange County area.
Awesome.
Yeah, that's great. Yeah, and you just
It's
opened one at UCI, University of California.
Yeah, we're in the athletics department there. Yeah, so it's awesome. Yeah,
big time.
Yeah.
So yeah, maybe a little background
Sure.
on you as a younger athlete and what kind of got you into physical therapy.
Yeah, so basketball is my sport. Love playing basketball. Played it throughout high school. And then, came to a point where you kind of have to come to a realization as a kid of like, okay, are you going to be able to play college? And I couldn't dunk at that point. So I realized, okay, hey, this is going to be a hard task to follow. So I said, what's the next closest thing? And I wanted to be around sports. I wanted to be with the team. I wanted to be with the players because that's kind of who I was. And I got introduced to sports medicine. So I went to college in the path of kinesiology, sports medicine as an athletic trainer, as a student athletic trainer. And this was back in 2004. So, or actually 99. So when I graduated in 2003, I was able to sit for my ATC exam, which is totally different now. Like you have to go to a master's program and you have to become a lot more time needed. So after I graduated and I kind of worked with all the sports teams, I sat down, took my test. One of the I don't know if you guys, any athletic trainers out there listening, but prior to it all being multiple choice, the athletic training test, NATA test, was the hardest test I've ever taken.
Wow.
It's a multiple choice, then it's a highlighted multiple choice. So you have to highlight every correct answer on a question.
Oh, wow.
And if it's wrong, it tells you, you just killed this athlete, you just paralyzed him. Skip all of these questions, go to the next set of questions, and then you have a practical. And this was at SDSU. You have a practical, so you're sitting in an auditorium and you're trying to tape an ankle, and you have like 20 professors just watching you. And the person you're taping the ankle is a professor. So they're looking at you and they're like, this is terrible. What kind of tape job is this?
The sweat is running down
It was like the most nerve-wracking. And then I go and I sit for the APTA test. I'm like, oh, this is a piece of cake,
Wow.
It's just multiple choice. But yeah, since then they changed it because it's so much that took a lot of effort to grade all of that stuff. But that's kind of like a side note. So after I did athletic training, I was fortunate enough to one of my mentors. He was with the Cleveland Browns, and he gave me the year-long position, the internship with the Browns. And so I moved to Cleveland for a year after I graduated. And one of the things I learned from there, this is kind of where all physical therapy really came from, is the assistant athletic trainer was doing more than what the head athletic trainer was doing. And in the state of Ohio, it's very, very specific of like what licenses can do what. And so I'm a new grad, and I'm like, hey, how come you're doing all of this, manual work and all of this, rehab and stuff, and the head athletic trainer is kind of like in the office, doing a lot more admin stuff. And he said, well, I'm an athletic trainer, but I'm also a licensed physical therapist. And I was like, oh, okay. So like, what are those differences? So I started researching that, and this is all while being with the Browns and, going to, we had games and preseason and all that stuff. And so I looked into it and I was like, okay, this is something I want to do. So then I applied for PT school. I got into USC. So I left Cleveland early so I could go to school for PT school. So I went to USC, graduated in 2007, was super excited about, just doing more, having a dual credential. At this point right now in my career, I recommend it to everybody because if you want to do sports, it's, it opens the doors for a lot more things because now they're hiring you as an athletic trainer and as a physical therapist. So your two salaries combined into one essentially. And so that's what helped me with my next job so after PT school, my last my last rotation was with Kaiser Permanente, and one of the professors there and one of the mentors there really pushed my limits as a PT. And he kind of told me, hey, if you want to learn more, you should do a residency. And so I did an orthopedic residency after graduating, and then followed that up with a sports fellowship because I knew I wanted to follow the track of sports medicine and sports PT. And then after that, I took a year-long course with Claire Frank. So I went 3 years after PT school, just continually learning.
Wow.
And with Claire Frank, her movement science course, it ended with DNS. And so at that point in 2009, DNS was really just starting in California, in America, really. It was obviously very big in Prague, but Claire, was bringing it in here. And so she added it into her year-long movement assessment course. And so I learned about it, and I was like, this is really unique. You're taking the movements of a baby that's in their first year of life and applying those movements to adults, because if we're talking about a healthy baby right now, no issues or anything like that. A healthy baby, how they move and how they crawl is the foundation for their strength as they grow up. And so if you take those principles and you apply it now with someone that has a compensation injury or a weakness in a certain muscle group, you take those movement patterns of a baby, whether that's crawling, whether that's turning from supine to prone or prone to supine, or supine to quadruped, all of those things is a foundation of movement. And so that resonated a lot with me. And so every year after that, this was in 2009, I took DNS. To become certified is a process. There's courses A, B, C, and then D is in Prague. So I took A twice, I took B twice, I took C twice, because I really wanted to learn it and not just take it and then go to the next one. I wanted to really understand it. And so in the midst of all of these things, at the end of 2009, I was informed by all of all the sports people around that USC had an opening as the director of rehabilitation in the athletic training room. And so I applied for that and I got it. Again, I think what helped was being dual credentialed, because they needed athletic training and they needed physical therapy as director of rehab. So I covered tennis as my athletic training sport, and then I did all of the rehab. And so in the midst of all of this, I'm actually applying DNS to all of the athletes, football players. Matt Barkley was one of my first DNS guys that, I did all this stuff to. He was very reactive to the different points and stimulations. And he's still a good friend. And whenever I see him, I was like, hey man, let me get you moving a little bit. And so,
his son is on our all-star team.
Oh
so
yeah. Soccer, right?
For baseball.
Baseball. Okay. Yeah.
Baseball. Yeah. Our son Jordy is played against him, and then they're both on the all-star team. And
that's awesome.
So it's great.
It's a great family.
Yeah.
And so kind of going through all that processes of stuff, I took all the DNS courses and I went to Prague in, I want to say 2011. And, that's an experience by itself, right? You're with the top dogs of all of the DNS. They're all there. That's like their home base. All the courses are in their hospital. You're staying in a little kind of like an Airbnb in the middle of town. It was really awesome. And so, they hand you this baby that's crying right in front of you. They're like screaming because they're like only in a diaper, and they're like, okay, how old is this baby and what developmental age are they? And, so you're trying to, like, another hard test was the DNS test. So it was really, really cool. But, I got certified in 2011, I believe, or 12 after coming back. And so kind of applying all these DNS principles with all these athletes. So very fortunate to be at USC. You're dealing with 18 to 22-year-olds who are either going pro or going to the Olympics, and very highly motivated, right? Like, I think that's where, I was there for 5 years, from 2010 to 2015. And I made a lot of mistakes early on, and then, figured it out towards the last few years, because, these coaches, they're essentially jobs are on the line if their star player is not in. So there's a lot of pressure to kind of get to do the right thing and not just, stay focused on tunnel vision. If someone has patella tendonitis, it helped me to look at like, okay, is it the ankle? Is it the hip? Where's the core involved? And really minimally working on the knee. It's really the finding out the why. And so that really helped me in my processes of when I started Modus. I left 2015 and I started Modus in 16, was the approach of, why do we have this pain? Why is the pain there? Because anyone, there's so many, physical therapy has been around for a long time, and we can treat everything, right? But it's really understanding the why of why someone is hurt versus just fixing the pain of the tendon and just doing ultrasound and icing in there. Because if they were to rest for 6 months, that pain would probably go away. But then once they get back to the activity, if you haven't fixed the source of the problem, that pain is just going to come back. So kind of all of that led to the initiation of Modus, and Modus is Latin for movement. And so I really wanted to kind of have movement as like a stable part of the process of what I'm doing and what I'm teaching, because it's all about, you don't want to just lay in bed. You want to keep moving. You have an ankle sprain, you want to keep moving it. You don't just sit in a cast for a couple weeks. And so, that was kind of where it all started. And I was very fortunate enough to work with a lot of professional athletes during that time, and kind of have grown the business on, the ability to work with an active population that are highly motivated, kind of the same idea of college athletes and stuff like that.
Yeah, that's tremendous. And Tim, I know you want to say something about what Drew just mentioned.
Oh, no, I just think it's fascinating, and having that athletic background, as your passion, as your love, and then being able to be humble enough at that early age to go, okay, I've kind of reached my peak here, after recognizing that, you have probably had a jump like me, credit card maybe,
Right.
slip underneath there. And that, that's certainly a piece of my athletic background too. So I just appreciate, your background, and you explained it really well, and how things kind of got threaded together, and how things are based in movement as an infant. I mean, you can't go any further back in history than that. And I just love the
100%.
approach of the why. I mean, I'm all about that too. When I create something new, or I'm looking to innovate, it's why. It's all about the why, as opposed to the what or the how. That'll come later.
Exactly. Yep. Exactly.
Well, and at what point do you think that that really became the paradigm at which you look at conditions and challenges too? Because that's not what we're taught really in physical therapy school or chiropractic school. It's, if you've got a knee issue, you work on the knee. Was it DNS? Like, was it, what point really kind of showed you, hey, like, we need to look at the way that the entire body moves, like where are the challenges and imbalances, and what are really the causes, as opposed to just looking at the symptoms?
Yeah, that's a great question, because, when I was at SC, there was one particular athlete that I was rehabbing his ACL, early on in my time there. And, I thought he was ready, and I thought he was ready to go back. And when he went back, he retore. And, when someone re-injures under your watch, it's on you. You can't blame anyone else. You can't blame the field, it's like, that's on you. And so I had to self-reflect big time and be like, what am I missing? And so I had to look back at, like, okay, how did he get injured first? Like, his original injury. I went back to the videos. The benefit of a college, everything is videotaped, right? Practices, games, everything. So I went back, watched it, and then looked forward and looked at how he re-injured it, and said, okay, I missed the why of why he got hurt. And I treated him like, anyone would have just rehabbed him and kind of gone through the processes, and didn't look at the why. And then this kind of was like a theme early on. And so I had to really figure out, what it was. And so DNS kind of helped stabilize, like, more of like what I needed to do. but the college athletes, they really help frame my mentality of what I need to do, of like why, how do I not let them get hurt again, and figure out, okay, this this track athlete now has, a stress fracture in her foot. It's easy. Okay, put on the boot. Let's do some bone stimulation and all that. But why does she have this foot fracture? Not everyone has it. It's not like every track athlete has a foot fracture. So being able to figure out the why in that really changed my whole approach to everything. And things just started moving really, really well. Athletes started recovering really well. There was no re-injuries. They got back playing at 100% at a very high level. And so, really the call, because again, at a college setting, they're like walking through the door, like so because there's so many athletes, right? And everyone had something totally different. There was never the same thing going on. So yeah, it was a big jump into like understanding a little bit more of like why these people are getting hurt.
And that's one of the things I like to talk about too, is that, we're up against the wall because in school we learn the body and everything in a reductionist way by parts, right? You blow your knee out, you treat the knee, just like you were alluding to.
Yeah.
But we know as athletes, we like to be looked at as a whole person. We're not just parts. And the more we're able to do that, to look above and below for imbalances as to the why that knee blew out. So I appreciate that approach, and I'm all behind it.
That's awesome. Yeah. It's definitely something where, the physical therapy space hasn't really, bought into yet. It's more of just the check marks. Okay,
Yeah.
I did this, I did that. And it's what's really affecting our profession as a whole, because, as a business, we get a lot of people that are coming to us that have failed traditional physical therapy, which again is good for the business, but then it's bad for the profession, right? Because now it's like, well, what are we doing as PTs? And this is why I really got into teaching and doing courses and stuff like that, because the courses are meant for other physical therapists. Like that's who I want to like throw out all this information to, is that I want someone that's treating in Kansas to be thinking the same way that we're doing it here in Southern California, and so it's really just kind of getting that whole approach, out there.
Yeah. Once again, if you want to learn more about Drew's philosophy and what he does with his athletes, he's going to be speaking at the Sports Movement Symposium in June in some capacity. And you can visit Modus SPT on Instagram, and check out his courses. And Drew, real quick, yeah, I know we don't like to talk about athletes, but I think this kind of leads into, you getting the gig as the head PT for the Los Angeles Lakers, which had to have been a dream job in some capacity and really eye-opening in other capacities,
For sure.
especially as a basketball guy. But you spent a lot of time working with guys like Russell Wilson and others. Can you maybe, we kind of left it off at, you being at SC and doing some DNS. Where did it progress from there kind of quickly? And then how did you open Modus and talk about the progression of that as well?
Yeah. So when I left SC, I came at a point where I was like, okay, what is the next adventure? What is the next step for me? And I didn't want to become the head athletic trainer because it was a lot more administration work. I still wanted to be able to use my hands, use my mind a lot more. And so it started where I was starting to see a few professional athletes. And so when I made that jump, it was probably the biggest life career move to make, because at that point I had a family, I had kids, and I was, starting something that, wasn't there before. And so during that process of growing, I was kind of in the midst of like just grinding it out, working very long days. One of those things when you work with professional athletes, like they're not going online, they're not going to your website, they're not going on Instagram. They're really relying on a lot of word of mouth. And so I was able to kind of build a pretty solid reputation in the area of like, working with these professional athletes. So it kind of grew, and grew from NFL to NBA, all of that. And when the Lakers position opened up, it's such a small world. My former colleague of mine that when I was at SC was at Pepperdine, and he was an athletic trainer with the Lakers. And so when that opportunity came around, he, said, you should apply for this position. And so, I've been very blessed. God's been very good in my career, and I got that position with the Lakers. And, it was a very awesome experience in the sense of, that was like a great year for us as well. So many things happened. We started the season 0-11, and I told my wife, I'm like, oh man, I worked with the Lakers, and we're gonna have the worst season ever, and so we kind of progressed. That was when LeBron broke the NBA scoring record. So being a part of that was really huge, and working with him closely was like a great experience. And then we went to the Western Conference Finals. Like, we went really far that year. With all the different changes we made during the trade deadline and all that. And so it was such a great experience, so many highs and lows and all of that. But overall a great year. But it did take a toll on the business, and it was a lot of time, a lot of man hours doing that. And so couldn't necessarily do it much longer than a year, but it was a great experience in that year. And so in that time, Modus has kind of grown in the sense of like, just opportunities. If it's there, we kind of try to jump on it. And we've just been very fortunate to have a very strong name and recognition in the Orange County area, where we're kind of continually seeing, highly motivated people that really want the best technology. We bring in the best things out there, like the new X, and, work really closely with Therabody and a lot of different, pieces of technology that's coming out. And so, yeah, it's been great, man. It's just been enjoyable kind of seeing how it all progresses through the years. It's coming up on 10 years in 2026. It's crazy.
Wow.
Congratulations. Yeah. And so proud of you, man. You've been grinding for years. You're an excellent example of, just put your head down and just keep going. And, dreams like that, to be, especially as a basketball fan, to be working with, one of the most storied franchises in NBA history, with quite arguably who will probably go down in history as the greatest basketball player of all time. Right. To be there for the scoring record. I mean, it's just proud of you. You're a great guy, on top of that. And we're just, honored and privileged to be able to collaborate with you and work with you. And
yeah, I mean, same to you guys, man. I looked up to you guys.
I've had a great time. I've had a great time, teaming up with you on some athletes, Drew. I've really appreciated your open-mindedness, and, you're covering my butt when I screw up. And
no, never.
I just really appreciate your humility and your truth. And it's super motivating for me. I've been in the business, like practicing 40 plus years now. And I can tell you right now, you are a rare entity, and anybody that gets to see you is going to have a great day and potentially a better career. And I'm not just blowing smoke. I have a very hard line when it comes to treating athletes, because I take it very personally too. 100%. And so I just wanted to let you know I appreciate you from the heart.
Thanks, man. I appreciate that. You guys are definitely people that I look up to and call mentors, and obviously friends. But just through the years of knowing you guys, it's just been great, and being able to collaborate, and the whole stigma of PTs and chiropractors, like that doesn't make any sense. Like you kind of just meet the right people, and you kind of have the same thought process and things like that. It's been awesome.
Yeah, it's not the letters behind the name, it's the person inside the body, and whether you're a guy or a gal, it doesn't matter. It's just where you're coming from, and if you're curious about the why.
Exactly 100%. That's what at the end of the day, that's what it's all about. You have to be motivated to understanding the why. Yeah.
And it ain't easy. It ain't
No,
always easy. You know, the
no, not at
road,
all. Yeah,
there's rarely a 90-degree angle there.
no,
It's usually curving and going up and down and all around, and not a lot of simplicity to it, but a lot of humility comes with that, and a lot of great lessons.
definitely, definitely.
Well said. And based on our technical challenges this morning and the fact that we've got patients waiting, we've got about 5 minutes to try to crank through the end of this. So you mentioned manual therapy. You do a lot of manual therapy. You actually came and brought some of your PTs to one of the SPRT therapy courses where Tim talks about and teaches, soft tissue and taping. Could you just really briefly talk about, how you utilize, because not every PT or chiro does actual manual therapy. I mean, the importance of improving tissue quality before you're trying to activate the brain and get through your rehab exercises, and how that's kind of benefited your athletes and your process.
I mean, learning from Tim is like, going back in the day and learning from like a Greek god or something, but really trying to feel what he feels is, probably the goal of every clinician, right? Because, he can put his hand on somebody and really understand what's going on just by the feel of that. And I think for me, it's all about learning, right? If you're at a point where you're like, oh, I'm good at where I'm at, then you've kind of failed in your career, because if you think you know everything, there's so much more to know. There's so many more people to learn from, and I want to give that to my employees as well, and even for myself. And I was at that course, so understanding what's happening in the body and feeling it and doing these soft tissue techniques, is it's what separates you from other clinicians, and I think that's where we want to be at. And even utilizing some of the techniques that Tim did in the course to my current patients and athletes. They're like, what is this? I've never done soft tissue like this before. And it's, explaining the science behind it, explaining how Tim explained it, really kind of helps prove the point that, like, yeah, there is more to learn. It's not just, hey, let's just put cupping on it. Hey, let's just do like a effleurage massage kind of thing. It's very intentional and purposeful. And I think that's, one of the things where I think if anyone has the opportunity to take the course, whether it's in person or hope maybe you guys are doing some stuff online, I would definitely do it, because there's so much value to that.
Well, thank you.
So Tim, fire away. We've got a couple minutes. You had a couple quick questions. Drew's
true.
Crank out the answers like he's on. Pardon the interruption, and the clock is ticking down.
So we go to school. We go. We learn from our mentors. We have our ways of learning. But I've always, especially the great ones, there's a lot of good athletes, and that's probably what we were. But there are very few great athletes, and so tell me something that you've learned from one of the greats. Whether it's about life or sport or therapy, is there any lesson or any, hacks that you've learned from an athlete that you just went, pew, this is going to stay with me forever?
Yeah, so, John mentioned it earlier. One of my clients that I work with is Russell Wilson. And, one of the things, and I've known him now since 2015, 2016. And, I was at his wedding. We kind of become really, really close. And one of the things that he always tells me, because he's a professional athlete, he makes mistakes, and he has successes and he has mistakes. And, when he throws an interception, one of the things that he keeps saying to himself, like as a psychological motivator, and then what it applies to him as life, is you just go to the next one, go to the next play. You don't think about it. You don't dwell on it. And I think this is a problem with, a lot of individualized sports, specifically like tennis, golf. You have a bad serve. These guys can serve it perfectly, but when the pressure's on, it changes the way they serve. It changes where the ball placement is. And I think one of the things that I learned from him the most was just, let it go and go on to the next thing. And I think that applies to me in my life, and then even in PT, because, you know, sometimes things don't go the right way, and you don't want to dwell on that, and you don't want to, you know, put too much focus on that, because then you don't get the progression of the next thing that you need to do. Because maybe one of the hypotheses that you didn't work, and then you're kind of sitting there stuck, and you're like, oh, but I thought this would. It's like, no, okay, let's go to the next thing. And the same thing in life, you know, with my, you know, anything, you know, nobody's life is perfect, right? There's always ups and downs. And so in my life, it's more the same thing. Like, okay, you know, this happened, we got to learn from it and then move on. And kind of one of those things where, and I always tell Russ, like, I'm like, you know, those are that life lesson of, like, for you, where you have millions of people watching and everyone's critiquing what you're doing, to be able to throw an interception, and then the next play, the next drive, you throw a touchdown, and not let any of that interception stuff, hearing noises, hearing people from the sideline, like they get it a lot more than any way we would get it, right?
Yeah,
because
yeah,
no one's tweeting about us, like, oh, you know, screw you, blah blah blah, you know, how did you do this? No one's doing really that to us. And so for him to be able to just let it go and kind of progress in the next step of life and what he needs to do, and it's one of the attributes that I really love about him.
So short-term memory is
100%.
Yeah. And that's great, because you never really lose in life or in sport unless you lose the lesson. So
right.
I think that's wonderful stuff.
That's
Thanks,
great. That's a great line. Yeah.
Yeah, you win or you learn, right?
Yeah.
And that's a great transition, or kind of segue into, you know, so going back to you as a younger basketball player and athlete, knowing what you know now, you know, number one, what do you wish that you had known then as a younger athlete? I mean, maybe once again, we talk about this with our other guests, you know, maybe we're sitting here talking about you breaking the all-time NBA scoring record, you know, instead of somebody else. But, you know, what do you wish that you knew then? Real quick, what were maybe some of your challenges? What do you wish that maybe you had access to then? I'm sure the answer is a sports PT like yourself that's not just looking at the knee.
Yeah.
But you know, what are some of the things that you really impart to your younger athletes and just say, man, this is so paramount, this is so important, and if you do this, it's going to change, you know, the trajectory of your career, which lots of times is just, can you stay healthy, you know?
Yeah. Well, I think a lot of that goes, and we're still preaching this to this day, is, you know, recovery and taking care of your body. Because, you know, we work with a lot of youth athletes, and I feel like for us, and maybe it's the same for you guys, but for us, we're a profession that's very reactive than proactive, right? They'll come to us once they get hurt. And what we're trying to do is, hey, let's do this stuff so you don't get hurt. And I think those are the things that has never really been pushed on people. And I talk to all these players that are now retired, and, you know, they have all these injuries, and they're like, I wish I just would have stretched more. Or I wish I would have just, even though I wasn't hurt, I wish I would have went to a PT or a chiro just to get treatment done, because now I'm looking at it and I'm like, holy cow, like my body's falling apart. So they implement that to their kids, but when you don't have a retired pro or something like that telling you something like that, it's harder for us, because then parents are like, oh, you just want our money and you just want us to come in. I'm like, what's more important? Like, you know, 6-week protocol of prevention or 12 months of rehab because they tore their ACL? Like, this kid is at a high risk, but because they don't have any injuries, every parent is like, oh, my kid is elastic. They're not going to get hurt. They're not the one the other player might get hurt, but not my kid. Right. And then they come in the door saying, shoot, I should have done more stuff to help this kid not get hurt. And I think that goes all the way back to, like, even when I was a student athletic trainer, you know, like, these athletes were getting hurt and no one took care of their high level athletes, you know, to be at a Division I and get a full scholarship. Now it's different because you have NIL and there's a lot more money involved. But back then it was just like, I want to get a scholarship. I want to play. And no one really thought about, okay, what can I do to stay on the field? It's, hey, you go to the training room after you got hurt. Not too many
Right.
people went to the training room, to not get hurt. And I think that's, any upcoming, athlete or potential, maybe in the middle of their career, they're not really sure. Yeah, maybe you don't need like someone full time, but getting advice and getting some exercises to do is not going to hurt in comparison to what a rehab process would look like if you had a major injury, surgical especially.
So proactive versus reactive, huh?
100%. That's my biggest thing. One of my things I have on my website, the greatest ability is availability. So if you're not available, then what's the point? You could be the best athlete, but you're always injured. You're always on the sideline, so you're never available for the coach or the team. And so
we've seen that plenty.
Oh yeah, 100%, and so like, it's all about, availability. And are you available? Can you be available? Like if the coach needs you, you may not be the starter, but if the coach needs you, are you healthy and available to play? And so like, that's kind of one of the big things we kind of try to push. It's just, you get a lot of resistance with families and coaches and stuff like that.
It's a hard truth because our society is not wrapped in that blanket.
Mm-hmm.
Our society is also a reactive society.
Always. Yeah. In everything,
Yeah.
In everything.
Yeah, it's such an important message. We say it all the time. Rehab isn't just for injuries. I mean, that's the stuff that you should be doing on a daily basis, whether you're hurt or whether you're trying to not get hurt. Everybody wants to go in the gym and get big and strong, but they don't have the foundational stability and neuromuscular control in order to be able to support that strength. And that's what really leads to imbalance and injury.
And there's a lot of research showing that injuries occur later in a game or later in the season. And that's due to fatigue, right? Yeah. Like if you look at soccer, majority of their injuries are towards the end of the season or in the latter half of a game, like in minutes 75 to 90. And so are they getting enough recovery? There's so much recovery technology out there. Like now, BFR is used as a recovery technique because now you can put BFR on your thigh at 100% occlusion and put that on for 3 minutes on and then 3 minutes off. And it's like putting on a compression boot on steroids because it's actually fully compressing from the top of your thigh on. And so that helps move all the lactic acid out, all that stuff. So we're really trying to implement that with all the college athletes we work on. It's like, hey, if you got time and you're not in class and there's no practice, like just come and do some recovery stuff because that's going to help you stay at a higher level throughout the season and throughout the whole processes of like, what's going on in practice and the stresses of school, the stresses of everything else around you, the pressure of playing, like being able to be available and active and recovered is the first step to everything.
Yeah. And it's not just high school athletes. I mean, we have, professional athletes who've just signed $50-70 million contracts and you're trying to tell them, they're like, what are you talking about? Like, how how much money I'm getting paid every year? And you try to say, yeah, but you see them move and you say, look, but this is going to happen. Get ahead of it. And very, very few, are proactive in the sense that, they really take the time to address those imbalances. Yeah. Then they're reactive. Then they come back in when they're hurt and then they get better. And instead of continuing to do, their stuff, there's no more pain. They're feeling good. So they stop doing that and go right back to the stuff that kind of got them there in the first place. So
that's exactly the mentality. They're like, I got here with this, I got this $200 million contract the way I am. And I'm like, yes, but you're also getting older and you're not 20 years old anymore. So like you have to really start taking care of your body. But yeah, I mean, you hit it. You guys are right on it.
Yeah. Well, and once again, I think we could do 4 hours on this, but in an attempt to keep us from getting yelled at. Yeah. Thank you so much for joining us. Really, really appreciate you. Thank you guys. And once again, Modus SPT on Instagram. Drew, you have anything else that you want to share with people as far as how they can get a hold of you or find you?
No, I mean, that's our same website, modusspt.com. We have courses that are meant for practitioners and we have courses that are meant for clients. So if, you're an athlete listening to this and we have one specifically on rotational athletes, and that's pretty much majority of all of the sports out there, soccer, golf, tennis, baseball, every sport really is a rotational athlete sport. And so it gives you exercise, it gives you techniques of like what to do, kind of the approach of the why of different injuries and stuff like that. So if anyone's interested, it's definitely on our website as well.
Great.
Thank you so much.
Thank you
for
guys.
joining us.
Appreciate it.
For Dr. Tim Brown, Dr. Drew Morcos, I'm Dr. John Pecora. Thanks for joining the SPRT Therapy Podcast. Have a great day.
Thank you guys.
Take care. Stand tall.
Thanks again for joining us for today's SPRT Therapy Podcast. Stay tuned for new episodes in coming weeks. And please check us out on Instagram and online at sprttherapy.com for upcoming events and discounts on live educational courses. Until next time, have a great day and stand tall.
I lay on the beach, watch the sunset undress as I wind down.